As India's prime minister heads to Israel, it feels like a new chapter is about to begin. High-tech and defense are on the agenda, building on an already strong strategic partnership.
Well, there's one massive untapped potential here, and that's cooperation in healthcare. Okay, so these two countries have totally different healthcare systems, shaped by their unique histories. But for all their differences, they face some surprisingly similar challenges. Let's start with their workforce.
Israel is staring down a demographic cliff, with a quarter of its doctors nearing retirement. And India's in a similar boat, a major shortage of doctors and nurses, especially in rural areas.
But here's where things get really interesting. Both countries are absolute powerhouses in technology. You know, this shared tech DNA makes them a perfect match, where one's strength meets the other's need.
For India, the biggest hurdle is getting quality care to its huge, spread-out rural population. And Israel's strength? It's a world leader in cutting-edge digital health, like AI diagnostics.
So, it's a classic win-win. Better rural healthcare for India and field-tested tech for Israel.
Okay, next challenge for India, building up its nationwide disaster and emergency response systems. And Israel, born out of necessity, has world-class, field-tested expertise in trauma care.
Working together here could seriously boost India's emergency readiness and, frankly, save countless lives.
All right, let's shift gears to another area. But this one, it needs careful consideration. For many Israelis, the high out-of-pocket cost for medicine is a growing and very real burden. Meanwhile, India is literally known as the pharmacy of the developing world for its generics.
Now, this presents a really interesting synergy to explore, one that could lower costs for Israelis.
So the big question is, how do you make this actually happen? How does this vision become a reality?
It starts with 3 quick, achievable wins: digital health pilots, sharing trauma protocols, and exploring pharma. Look, this is way bigger than just healthcare. It's about 2 tech-savvy democracies joining forces.